Supply and demand was the big topic at the City of Florence's coronavirus update today. More people want the vaccine, but the state is falling behind in administering the doses. Our Nixon Norman tells us how city and state leaders are trying to get the vaccine out to those who want and need it.
Each state is experiencing the same concerns, the same issues that Alabama is experiencing, and that is we have more demand than we have supply.
And there seems to be a large difference between allotment and administration of vaccines.
While numbers look large when you say, well, this much has been allocated to Alabama, it's still a relatively small number. Our current vaccine administration in Alabama is, as of yesterday morning, we had vaccinated 42,811 persons. And our allocation to Alabama as of yesterday was 226,000 doses.
Those numbers show that only about 20% of the vaccines sent to Alabama have been administered, but they're making some progress.
Last week we had given 20,000 doses. This week we're over 40,000 doses. I expect that to exponentially increase.
More and more people are signing up for appointments to receive the vaccine. Fortunately, places other than hospitals are now receiving vaccines, such as nursing homes and health departments. But as of now, only people in Phase 1A can receive the vaccine.
So certainly people want the vaccine. We want to give the vaccine.
Landers also said that some regions will move more quickly into different phases. Phase 1A, which we are in now, only allows doses to be given to people like healthcare workers, first responders, and nursing homes.
Our commitment is that every vaccine dose will be given to a person, will be put in a person's arm.
It is still projected that most people who do not fall into those categories will be able to receive the vaccine by spring. To find out which phase you fall into, visit our website at rocketcitynow.com. Putting the Valley first, Nixon Norman, WZDX News.